On May the 3rd, 2005, I was out riding my motorcycle one afternoon out in the country. I was involved in an accident. A school bus wound up sideswiping me and broke this left leg and this arm up very badly. I was taken to the medical center, which they set the leg and did some skin grafts and stuff on the leg. And then approximately a year later, I had an abscess come up on the side of the leg and was referred to the Hughston Clinic. I was very pleased to come here because I had been told that by several doctor friends and that the Hughston Clinic was probably the best that I could expect. And I was very grateful, very pleased because I felt like I was getting the very best that I could do. He came in the next morning after they had run these tests and told me to prepare my mind and heart for the fact that I probably was going to lose the leg, which was quite devastating. He also told me that part of that bone, particularly the upper part of it, they would have to take the leg off so high that there probably would not be enough stump left for me to even wear a prosthetic device, which meant that I would have spent the rest of my life either in a wheelchair or on crutches as a one-legged man. And that was a sad, sad time. Well, the next day, and they told me that there was a procedure that could be done. It wasn't 100% sure that I could even stand it, that it was very painful, it was a very slow process, and that some people just simply couldn't take it. And so we agreed I wanted to try it. They put an external fixator on my leg. They had to cut both ends of the bone back to where there was good bone, and they wound up taking almost 5 3/4 inches of thigh bone out, which meant that left leg was that much short. But the external fixator had threaded rods on it, and each day I would have to move those rods, and the process is, and your body continues to put bone in there, and you continue to move it apart, and I regrew what was taken out of my thigh bone, which for a 35-year-old man would be a miracle in itself. But for a 65-year-old man, which I was at the time, I consider it a major miracle. I've gotten to the point now where I live a normal life again. I do yard work. I mow the yard. I work in the flower beds. I go fishing. I get out and walk when the weather's good. I'm very grateful. I feel like I got the best possible medical help that I could possibly have had. I don't walk very gracefully, but I do walk. I walk very gratefully. I'm thankful that I'm able to live a normal life again. And I think this is the finest facility in the South, maybe in the nation.